Alcoholism, presented by Hannah Newman, Araceli Hernandez, and Isaiah Gonzalez.
Here are some vocabulary words that are associated with alcoholism, such as cirrhosis of the liver, end-stage liver disease characterized by significant abnormalities in liver structure and function, may lead to complete liver failure. And also alcohol abuse, a pattern of alcohol consumption, whether chronic or occasional, that results in harm to one's health, functioning, or interpersonal relationships.
Alcoholism was deemed a disease in 1849 by physician Magnus Huss.
Origin of name: alcoholism, disease of alcohol addiction.
Systems affected by alcoholism include central nervous system, cardiovascular, and digestive. Alcohol slows down the chemicals and pathways in your brain used to control your body, altering moods, slowing down reflexes, and affecting balance. It can also contribute to learning memory and sleep problems. Alcoholism affects the heart, increases your heart rate, expands your blood vessels, making more blood flow to the skin, which causes you to feel warm. However, this heat passes through your skin and causing body temperatures to fall after it has risen. Alcohol affects the digestive system by promoting an increase in digestive juices. Alcohol also irritates the small intestine and colon, where it is further broken down and absorbed. And it also affects the normal speed that the food passes through the intestine, which may result in abdominal pain, bloating, and diarrhea. Alcohol also affects other organs such as the kidneys and the liver. Alcohol is metabolized in the liver, which filters circulating blood and removes and destroys toxins, including alcohol. The liver can handle a certain amount of alcohol, but as a person continues to drink, it can become stressed to the point of causing permanent damage. Some populations affected by alcoholism include college students and professionals. Of all college students in the U.S., approximately 45% of students ages 18 to 24 engage in what can be considered heavy episodic drinking. Professionals come home after a long day of work looking forward to a drink to sink the day away, leading into a spiraling routine of addiction.
Average cost of treatment. Traditional rehab costs can range from $5,000 to $80,000 or more for patients, but this range varies based on the type of facility and what is offered. Factors of alcoholism: personal history of low self-esteem, anxiety, and/or depression. Individuals who suffer from depression, bipolar disorder, and social anxiety are much more likely to develop alcoholism. Individuals who are more likely to pursue or disregard risks are more likely to engage in heavy drinking. Those who are less inhibited may drink more. Studies have shown that when alcohol is consumed before or with meals, food intake is greater by as much as up to 30%.
Environmental factors of alcoholism include a family history of alcohol use disorder. Those who belong to families, cultures, and subcultures where drinking is traditional or encouraged, such as college. Mental health disorders such as anxiety and depression. Those with high-stress jobs, extreme pressure at work, like the military. Adolescents and young adults with low self-esteem and high peer pressure, and high levels of emotional stress, such as losing a loved one.
Dietary restrictions of alcoholism. People who drink more are also likely to eat less fruit and consume more calories from a combination of alcoholic beverages and foods high in unhealthy fats and added sugars. Alcohol use can actually stimulate increased food intake.
Here are some preventative strategies for alcoholism. Choose not to drink too much yourself and help others not to do it. If you choose to drink alcohol, follow the dietary guidelines for Americans on moderate alcohol consumption. Support effective community strategies to prevent excess alcohol use, such as those recommended by the Community Preventative Service Task Force. Do not serve or provide alcohol to those who should not be drinking, including people under the age of 21 or those who have already drank too much. Talk with your healthcare provider about your drinking behavior and request counseling if you drink too much.
Available tests. The most commonly used alcohol screening tests are the Alcohol Use Disorders Identification Test. This test contains 10 multiple choice questions about how much and how often you should drink alcohol, and if you have any alcohol-related problems or reactions.
Available treatments. Go to detox. If you are inpatient, this option may be best if you've been misusing alcohol heavily. If you are an outpatient, you visit with your doctor or health provider for treatment during the day. See a counselor or therapist. Medications. Medicines can cure alcohol use disorder, but some can help you recover. They can make drinking less enjoyable, so you don't want to do it as much. What to expect. Recovery can take a long time, so you may need ongoing treatment. And some people in recovery do not relapse and drink again. If you do not think you failed. It's often a stage in the process.
Here is a small summary of the diagnosis criteria that an alcoholic can meet. Alcohol is often taken in larger amounts or over a longer period than it was intended. There is a persistent desire or unsuccessful efforts to cut down alcohol use. A great deal of time is spent in activities necessary to obtain alcohol use or recover from its effects. Craving, strong desire, or urge to use alcohol. Recurrent alcohol use resulting in a failure to fulfill major role obligations at work, school, or home. Continued alcohol use despite having persistent or recurrent social or interpersonal problems caused by the effects of alcohol.